Together, doing this together. All right. So what we're going to explore, I have just a few slides, and then we have some presenters that are going to give you information that you all came here to hear. So if you would, please advance me to the next slide, just to give you some, we'll call it rules of engagement here. This presentation is being recorded. A copy of this presentation will be provided to you in case you want to revisit and explore any of the details that were provided. There are a few interactive activities, if you will. We might have a poll or two. And then as we go, there are maybe some questions you have. We'd advise that you drop those questions into the chat. That's going to give us the opportunity to collect those questions, and we'll have a very unique time carved at the end, right? So we'll have dedicated Q&A time at the end of today's session. So make sure if you have questions that you're dropping them. And of course, some things that you should know: external AI assistants. You got to leave your robots at home. Due to California privacy laws, we are not admitting them into this meeting, not today. So as we get started, I'm just curious, and I would love to hear from you. Would you just tell us in the chat on this next slide, what county are you joining us from? I know we have counties representing all over the state. Maybe tell us the county and the agency. That would be kind of fun. You could just drop it right into the chat. Where are you joining from? First Five, welcome. I'm a First Five alumni. I was a care coordinator in San Diego too many years ago. I won't tell you. Wonderful. LA County. Awesome. So I'm seeing folks up in our northern region, our central, inland, coastal, representing down here in San Diego. Welcome. All right. LA County, welcome everybody. Great. So as we are kind of learning about you and learning about each other, I do have a few preliminary questions just so that the conversation can be as tailored as possible to the folks in the room. I will actually start the polls myself, so let me get it started. The first question that I have for you: which of the following best represents the organization you're here with today? If you would just tell me into the chat, where are you? I'll give you a second to enter that, find your way to that poll. Great. I see Anne joining us from County of Orange. Awesome. Tell us in the poll where that is. Okay. And if you scroll down a little bit, by the way, there's a second question in there, kind of sneaky. The second question is, are you currently delivering parents as teachers? Maybe you do. Maybe you're not there yet, but you're thinking about it. Maybe you have not been swayed like go time, so you're here for more information beforehand. So all that, those are in the one poll with the two questions. I'm going to give you just an extra couple seconds. Okay, let me end this poll and show you what you said. This is exactly what we were hoping for. So if you look at these results that should be on your screen, what you'll see is there's some representation around the state from different people. We have Child Welfare Agency, we have community-based providers, Tribe, we have some others which have dropped into the chat. That was kind of the hope here. This is a watering hole, if you will. This is where everybody is coming for the right information. And if you scroll down, you'll also see how many people that are currently offering parents as teachers. So for anyone that's not able to see it, we have about 61% that are currently offering, 11 that have not started yet, and 27% are still considering. Perfect. That's what we were hoping for. So let me share this last result. Here we go. Okay. Now, what I'd like to do, of course, we want to talk about the agenda and who's here to speak and all of those fun things. But first, we want to set the stage a little bit, just give you some guidance on how did we get to a place where this work group happened. And to do that, I would love to introduce Barry on the line. Barry, are you with us?
I am here.
Hello.
Thank you, Jess. I'm Barry Johnson. For those of you who don't know me, I am a consultant with the County Welfare Directors Association, and on behalf of CWDA, welcome to everybody. I'm going to set the stage a little bit and talk about why we're here. So first and foremost, this is really an opportunity to get folks who are either considering or actively delivering parents as teachers to build a community together, to share information, and to help one another and give some mutual support. So that's what we're hoping to get out of this. We know that there are 10 EBPs that are being offered as part of the Family First Prevention Services Act. implementation here in California. We chose parents as teachers as the first one to start with because it's the second most common. The first one is motivational interviewing, and that one's got a lot of complicating factors. So we decided to start with parents as teachers. So first of all, we're hoping to build a community. Second of all, you're going to hear some clear expectations and some level setting about the data collection and continuous quality improvement processes for parents as teachers. And you'll hear more about the CQI process there's going to be a lot of TA and training regarding CQI and about the data. But we thought we would start today by focusing and setting some clear expectations about that. We hope that ultimately that this group will evolve so that people can share their successes and challenges and talk about together and talk hopefully offline even about how they can resolve them. So that's what we're hoping people get out of it together. And then we also want to give people a preview. I said that there's lots of training, TA, and support for CQI, but we also want to give people a preview of other stuff that's coming up that's going to help with your parents as teachers implementation. Or you're planning to deliver parents as teachers. So that's what we're hoping you're ultimately going to get out of this hopefully series of meetings about parents as teachers. And you can go to the next slide. As Jess said, we've got the innovators here. You're the leaders. This is the very first one of these we're doing, so we're hoping to learn a lot about it. There will be additional parents as teachers related sessions. We will be launching other EBPs, provided that things go well here, other sessions for other EBPs. So I already mentioned motivational interviewing, but there's the 10 EBPs. We'll probably start with those that are been selected most often by counties in their comprehensive prevention plans. And run a series of them. So really invite you to think about and share what would make additional sessions most useful to you. We want this to be something that is led by you and helpful for you all as you provide or stand up parents as teachers. So that's a little bit of the stage setting, and I will turn it back over to you, Jess.
Wonderful. Thank you, Barry. And something that I want to highlight that Barry said, and we'll see this more on the next slide. Ideally, you're in the driver's seat of this conversation. As participants, the information that you receive is ideally information you want to know. And so in this first one, these are the agenda points that we've come up with that we believe are what you are most asking for. So if you see a number on there that you're like, ooh, yes, that's why I came here, tell us the number in the chat, because it might be multiple numbers. It might be all the above. This only helps direct what the future sessions of these type of work groups look like. So it's going to start with an overview. What is parents as teachers? Give you like a little brief overview from none other than the director of the CEBC herself, Jennifer Rolls-Roots, who will be speaking next in just a moment. We also are going to give some data brief, a review, if you will, from Chapin Hall. What does the data say? We're going to take some Q&A questions. And then really kind of figuring out, so how does this plug into the big picture? What is happening? What are some next steps? What are we doing here? So as you look at 1 through 6, I'm just curious if there's any in particular that stand out to you about information you're most excited about or interested in. Will you just tell me in the chat? Maybe you want an overview of an EBP when you come here. Maybe you want to see what the data says. Maybe you want to bring your questions to the professionals. Maybe you want to see how it plugs in. Maybe you're here because you want to see how it fits into the grand scheme. That would be number 5. Or you're just interested to be part of a series of sessions. Great, thank you. I assumed 2 to 5 would be popular. Thank you for highlighting that. I see your responses. I appreciate it. Great. So now that we know, the agenda, and by the way, you'll have your opportunity to share this feedback in a little bit. I'd love to introduce Jennifer Rolls-Roots, who's going to talk about an overview of parents as teachers.
Perfect. Thanks, Jess. You want to go to the next slide? Thanks. So as Jess mentioned, I'm with the California Evidence-Based Clearinghouse. which is also the same organization as Caltrin, California Training Institute. So glad to be here today. Like we said before, this is really a brief overview. We know that about 60% of you are already delivering parents as teachers, so you probably know what it is. But that means 40% are still in that like earlier stages or still considering it. So we want to just give a quick overview to make sure everyone was on the same page. We've got the Parents as Teachers website here. Great place to go to get all the information you need about the program, implementation, etc. Okay, we'll skip on. Next slide, please. So what is Parents as Teachers? Very briefly, it is a home visiting parenting education program. It's focused on new and expectant parents up through kindergarten age. So we're talking about really young kiddos. And it's intended to promote, positive child development, prevent child maltreatment, teach some basic parenting skills, etc. Next slide. And our goals, again, really fit with this prevention effort that we've got. We're increasing parent knowledge of early child development, what's appropriate behavior to expect between 0 and 5, so parents know what they're getting into and how to respond appropriately. We're trying to improve parenting practices, helping all parents have access to what's healthy ways to parent and what are some better ways to parent if they're experiencing challenges. Providing early detection of developmental delays and health issues. This ties back to some of that early child development. What's normal? When do you get concerned about a 2-year-old or a 3-year-old who maybe isn't, meeting their milestones, and what do you do about that? Obviously, we want to prevent child abuse and neglect. So that's, one of these goals. That's a main goal of FFPS. And then also with Parents as Teachers, it's to increase school readiness and school success. So we're trying to help these young kiddos get ready to, enter kindergarten and then future years and be successful in school. Next slide. So how is this all getting done? Well, a big piece of this is those personal home visits. So is the professional going out or paraprofessional and meeting with the families, meeting them where they are, seeing their needs, supporting them, and helping them get connected. Also helping them get connected, not just to other professionals and organizations, but also to peers. So that social support, that group connection of getting these parents together in the community. Obviously, child health and developmental screenings. How do we make sure that kids are getting the services that they need by recognizing what those needs might be early on? And then finally, again, building that community connection, community resource networks. How do we help these parents build natural supports in the community beyond just their parents as teachers, home visitor? Next slide. So as we mentioned earlier, this is 0 to 5. So in many cases, it begins prenatally. Ideally, it would begin prenatally and continue all the way through the child entering kindergarten, but parents can come in at different ages. So, there's quite a range there. You can come in prenatally, you can come in at age 3, etc. Services are offered again on a biweekly or monthly basis, depending on the family needs. So that's set up through each program and how they assess the needs of that individual family. And then sessions are typically an hour in the parent's home, but depending again on the family situation, they could be delivered in a school setting, childcare center, library, other community settings, wherever these families are, depending on their individual needs. Next slide. So the eligibility criteria is pretty simple. Now, every county's FFPS, the Comprehensive Prevention Plan, may have more specifics, but for parents as teachers, you're looking at expectant parents up until the child reaching kindergarten, so roughly age 0 to 5. And we're looking at families that are in more high-risk environments, so families who need the services, who could benefit from having these home visiting services. And again, every plan probably has some criteria of what their target population is and which families they're targeting. Okay, next slide. And then if you are delivering parents as teachers, this is a model that does allow for paraprofessionals. So we're looking for a high school degree or a GED, but someone who has 2 or more years of experience working with families, with kids and families. So pretty broad. And so paraprofessionals are fine. They can be people from the community all the way up through, licensed staff, quite a broad range for this one. For the training, there is a 40-hour foundational and model implementation training that needs to be delivered. And I think, Derek, you were going to drop a link to the state's document on the EBP training requirements. This is currently a Google Doc, but it should be being posted more publicly in the next few weeks. So we'll make sure that gets out to the group as well. And also the training needs to be delivered by certified parents as teachers trainers. Again, if you go to their website, lots of information about how to get trained on parents as teachers and so on. And then I think my final slide is how does this fit into FFPS? So again, parents as teachers falls in this FFPSA area called in-home parent skill-based programs and services, which is a mouthful, but it's home visiting, occurs in the home, and we're targeting the parents to help support them. It does have that rating of well supported, as do all of the 10 programs that California has selected. And we have about 32 counties and tribes that are including parents as teachers in their CPP plan. We know not every county is going to actually implement, but we know that's the number that originally wrote it into their proposal. All right, so that's just a quick taste of parents as teachers. And now I'm going to turn it over to Michaela, who's going to talk a little bit more about data collection.
Great. Thank you, Jennifer. Hello, everyone. I'm Michaela Van. I work in the Safety and Early Intervention Bureau at CDSS, and I'm here today. I'm going to go over a few things about the CARES portal, or CWS CARES, and give you a few, just a little bit of information about where we are in that project before I hand it over to Jenny O'Keefe from Chapin Hall to go over the entire data elements for PAT. So the Child Welfare Services California Automated Response and Engagement System, CWS CARES, is going to be the new system that's currently being developed for California to comply with federal comprehensive child welfare information system requirements. A number of small counties will participate as early adopters in the pilot in next year. Then everyone will start using CWS CARES with a statewide simultaneous rollout in October of 2026. So CARES version 1 is intended to cover the functionality required to decommission CWS CMS, so it's going to replace our current system. It's also going to support new policies and programs such as our Family First Prevention Service Act, so FFPSA, and then it'll also lay the foundation for full comprehensive child welfare information system compliance in CWS CARES version 2. Next slide, please. All right, so where are we currently in our roadmap for the build out of CARES? Right now, it's still being built out. Implementation will start in somewhere around Q1 of 2026. Right now, the CARES team is building out many of the functions in the system, including the provider portal. So the provider portal is where providers will be entering the data elements needed to for our services and to make sure that we're correctly reporting everything to the federal government, right? So that's currently being built out. There are ongoing demos for CARES more in general, including the core constituent demonstrations and stakeholder demonstrations. We've had a few in the last week. Actually, yesterday there was one, and then late June there was one on 6/25. Demos for the EBP model fidelity and CQI data elements in the provider portal are anticipated to begin in fall 2025. So we hope that will still remain true as we move forward. And now I will pass it to Jenny O'Keefe from Chapin Hall to go over our CQI brief.
Thanks, Michaela. So hi, everyone, and I'm really happy to be here with you all today and talk about CQI. So I'm Jenny O'Keefe, a policy analyst with Chapin Hall, and we've been working with many of you. I saw Wendy Lee on this call, and Wendy's been working really closely with us on the CQI subcommittee for FFPS. And our goal today is to talk about all this work that we've been doing to prepare for implementing the CQI plan. So my hope for you today is that after I finish talking, and I've got about 40 minutes of content for you, is that after I finish talking that you feel a bit more clarity and confidence about what's expected when it comes to data collection and CQI, so continuous quality improvement for PAT in particular as it relates to Family First. So I just want you to know that I know that you've all been have the slides, and you might have had the opportunity to take a look at it, and you might have seen the content and said, wow, that's a lot of information, and this is a lot for us to take in. So I hope that as we go through this today, you will feel more clarity, but know that we've got some time. So like Michaela mentioned, we've got until 2026 to start tracking all of this information and inputting it into CARES for reimbursement from Family First $40. So we're going to be talking about those data elements that are required for Family First. So if you have any questions as we're going through, Jessica mentioned it earlier in the call or earlier in this meeting that you should pop them into the chat. So like I said, there's a lot of information that I'm going to be going over. Some of it is very technical, and you might have some questions related to it. I'm not going to be pausing during my presentation, but that doesn't discourage you from putting any questions into the chat, because we do want to know what you're thinking about. And then we do have some time dedicated at the end to review the questions and hopefully answer what we can. Some of them we might not be able to answer yet today. So now that we've set the stage, I really want to ground us in why this work around CQI and data collection is important and required in the first place. So many of you are familiar with Family First Prevention Services, but I just want to give a brief overview for anyone that is not super familiar, or maybe you might need a refresher. So under the Family First Prevention Services Act, states are required to submit a prevention plan every 5 years. These prevention plans lay out how the state will deliver prevention services to keep children safely with their families and out of foster care. And good news for all of you, California has an approved prevention plan. And like Barry mentioned, there are 10 evidence-based programs that are approved for California to implement for 4E reimbursement from Family First. So in those plans, the federal government said it's not enough to just say that you're offering prevention services. The federal government also requires that states include an implementation and monitoring plan. And that means that we have to show how we're keeping track of whether services are being delivered as intended and whether they're making a difference. So the exact language is in the law is written there. You can even put into Google the section of the act that outlines this requirement. But ultimately, it's just saying that these plans need to show how you're continuously monitoring the evidence-based programs that you're implementing. So go ahead to the next slide, because everything that we're talking about today is written in the CQI plan. So we're going to put that in the chat so that you can see the CQI plan if you haven't already. But like I mentioned, in order to meet federal requirements under FFPSA, we have to have these CQI processes in place and outlined really thoroughly in a CQI plan. So California's CQI plan is complete and it's publicly available, and it lays out how to track progress and improve Family First evidence-based programs like PAT over time. And it is much more comprehensive than what we're talking about today. Today, we're going to be zooming in on data collection and monitoring for 4E reimbursement, but the CQI plan gives a much more of an overview of how we're going to do that and the importance of doing that and who's going to be part of that process. Go ahead to the next slide. So that now that we've talked about federal requirements and really emphasized that the CQI plan and data collection is not something that California has decided to do on its own. California has moved forward with this plan because of federal requirements. We're going to look at what does CQI actually involve and what does CQI mean? So the slide that you see here has a lot of information that we use in the 40 jurisdictions that Chapin Hall is working at. This is the core components of a CQI system that has really been developed and designed, inspired by the Children's Bureau and CQI experts who worked with public systems across the country. So we're not going to be talking about all of the elements of a CQI system. Again, that information is outlined in the CQI plan, and actually the CQI plan itself is structured around all of those elements. It's structured around data infrastructure and processes, which is an important part of a CQI plan and a lot of what we're talking about today, but it also includes organizational commitment and capacity, resources, policies and procedures, and equity and inclusion, and an improvement cycle. So if you're curious about core components of CQI, I encourage you to look at the CQI plan. What we're zooming in on today is at the top, that darker blue piece of the triangle, the data infrastructure and processes. So part of the CQI plan and what we're talking about today is focused on 4 domains of a measurement framework. So a measurement framework meaning how we're measuring the progress for all of the elements of the evidence-based programs that we're implementing. So there's 4 domains in this measurement framework that we use in many of the state prevention plans across the country use these 4 domains, and they are reach, capacity, fidelity, and outcomes. So what we're going to do today is just give you a bit of an overview of the definitions of each of those domains, and then we're going to transition in talking about what does that mean for PAT. So PAT has data elements under each of these domains, but before we go through all of those data elements, we want to just give you a little bit of an understanding of what those domains are and how we came to determining what they are. So under FFPSA, states must report who is being served by prevention services in order to claim 4E reimbursements. So that includes the number of children and families referred to services, whether those children are 4E candidates or in foster care receiving reunification services, and whether they actually started and completed the service. So when we talk about reach, we're really answering some questions related to who is referred to an EBP like PAT, and of those people that are referred, who actually started the service, and of those who started, who completed it. These data points are really helpful for us to understand how accessible the service is and where families might be falling off along that referral and implementation path. So again, we're going to talk about what that means for PAT in a few slides, but just want to give you some context for what it means when we're looking at reach data elements. So now let's talk about capacity. So federal guidance also requires states to report how services are being delivered, not just what's offered, but who is providing it, how often, and for how long. So which providers or agencies delivered the service is something that the federal government is interested in requiring states to report on. And how many sessions or visits were offered, when services started and stopped, and why they ended. So these data points really help to show whether our prevention services system have enough staff, training, and structure in place to deliver the service consistently and effectively. So in this context, capacity really measures things like number of certified or trained practitioners and staff caseloads and supervisor ratios. So like I said earlier, we're going to talk through what these capacity data elements are for PAT in just a minute. So moving to fidelity. Fidelity is something that if you are implementing PAT already, or you're interested in implementing PAT, you might have heard that term, because fidelity means how closely the service was delivered the way it was intended to. And all of the well-supported EBPs have some fidelity monitoring requirements in order to become certified to practice the evidence-based program. So this is a term that is used by most purveyors or EBP developers. And most of the domains and the data elements that are chosen for fidelity are not ones that California or other states choose. They're designed and developed by the people that developed the EBP. So the people that developed Parents as Teachers determine what the fidelity measures are to really help to monitor if the service was delivered how it was intended to. So some fidelity measures could be capacity related. So asking if the agency provided the necessary resources to make the model work. Some fidelity data elements talk about process and quality. And we'll talk about what the specific ones for PAT are in just a minute. So the final domain of those 4 domains, so we talked about reach, capacity, and fidelity. And now the final domain of the measurement framework for EBPs in California is outcomes. So these are the actual changes or benefits to children and families after receiving the service. So that's really checking on what is measured by the EBP model itself and what your agency wants to measure, and also what's required for federal reporting. So there's short-term and long-term outcomes. Some short-term outcomes are things like improved parenting confidence, improved reduction of stress of parents, and long-term outcomes are typically related to child safety and family stability. So now let's start talking about what this means for you and implementing PAT. So we have developed evidence-based program briefs for 11 different, there are 11 different briefs. 11 because there are 2 different developers for functional family therapy. So in the chat, you will see in a minute the link to the brief for Parents as Teachers. And these are going to be a really useful tool for all of you. Even if you are already implementing PAT consistently, you're going to find these briefs are helpful for you to understand what is expected once you start to report on PAT services for 4E claiming. And if you're thinking about implementing PAT, these will be really helpful for you to really understand what does it mean when I'm told I have to track data elements in order to claim this service as something that can be reimbursed by $40. So before we show you the PAT brief, just want to highlight that there's an executive summary that gives a pretty comprehensive overview of how to absorb the information in the briefs and how the briefs were developed. So the briefs were developed with the FFPS CQI subcommittee and many other partners. And I know it was reviewed by many of the other subcommittees under the FFPSA advisory group. But I want to highlight right now, before we dive into the PAT brief, that it includes the data elements for each of the EBP briefs or EBPs. And those data elements were determined by the CQI subcommittee and other subcommittees reviewing it but most of those data elements are already required if you're implementing PAT. So they're also required elements, data elements for 4E federal reporting. There in PAT in particular, not any additional reporting requirements that were added beyond federal reporting requirements and PAT's fidelity requirements. This is not something where this group came together and said, we want this information about these programs. Let's add this to the responsibilities of providers to track. This is just compiling information that you're already tracking and putting it in a process that is consistent so that California can get reimbursement for these 4E services. So you'll be able to read that, absorb that when you're looking at these EBP briefs. We're going to dive into the PAT brief and walk through it and do an in-depth overview of the PAT brief. But like I said earlier, this might be a lot of information and complex, and you might later on think about I need to go back and look at this because I want to make sure I'm really prepared before I implement EBP for 4E reimbursement. And so take a look at the chat and find the link to this EBP brief executive summary and review that. But then also right now, we want you to take a look at the chat and find the EBP brief for PAT, because we're asking you today to follow along so that you can see the EBP brief on the website and take a look at the data elements that we're going through today so that you can look back and remember what we talked about. So parents as teachers is data collection isn't just about program monitoring, like I said before. This is for federal 4E reimbursement. And PAT providers are expected to enter reach and capacity data into the CARES provider portal every month. Michaela talked about that briefly. So the CARES provider portal is something that you'll have training in. And you will be, as providers, expected to enter the reach and capacity data. So in the next couple slides, we're going to talk about what data that is. And that's data entry every month. And then outcome and fidelity data will be reported by the PAT developer and purveyor. So you can see on here the parents as teachers brief. This is a screenshot of page 4. So page 1 through 3 is an overview of the program itself and the CQI process and an introduction, essentially. Once you get to page 4, it goes into those specific data elements. So all of the information and the data that you should be tracking and reporting on. So this is page 4 of the brief. These are screenshots, and you can see that there's a table on there. That's what we're going to pay attention today. We're going to just briefly mention the CQI prompts as well, but we've heard from you that you want to know what is the data that we need to be tracking. So you can see on here, this is for capacity. And on a monthly basis, you will go into the CARES provider portal and enter the total number of provider agency sites. So if you're entering number of agency sites, if you're one provider, you'd enter 1. You're entering the total number of full-time model trained or certified practitioners. So how many people in your site are full-time trained practitioners to implement PAT? How many are part-time trained practitioners to implement PT? And how many are supervisors? Just entering the number. We're looking at the supervisor practitioner ratio to confirm that there's 1 to 6. And then we're also looking at how many staff have full-time caseload or a part-time caseload. So making sure that you're entering the caseload amount and we're monitoring whether their full-time caseload staff have 50 families or less and a part-time staff has 25 families or less. Also entering the duration of service. So the full duration being 104 weeks or 2 years. And so all of this information is entered, and it's entered accurately. And when you're reviewing this information on a monthly basis within your county CQI work groups, if you have that established, and within a regional peer learning series, which we'll talk about briefly, we're looking at all of this data to see if there's any areas we might need some improvements on, or any areas that things are working really well. One area that might be working well is that all of your full-time staff have a full caseload, but not going over that full caseload. So moving to reach. So when we're looking at reach, again, these are related to federal reporting requirements. These federal requirements help us to track who is eligible for services and who's getting referred and who is receiving the service. So if you're looking at it on your computer and you found the link to the EBP brief for PAT, you can zoom in and see this a little clearer. This is a screenshot of page 5 to see all of the data elements under reach. And I know that it might look a little bit small on your screen, so that's one reason to pull it up on your own website in PDF so that you can zoom in and see that the reach elements include tracking the number of eligible child welfare and probation candidates. So we want to see how many families that are referred are eligible for child welfare and probation 4E services, prevention services. So looking at the total number of family maintenance cases, voluntary family maintenance cases, and 602 WIC petitions. And then looking at the total, or entering into the CARES provider portal, the total number of community pathway children granted 4E agency candidacy approval, and the total number of community pathway children denied 4E agency candidacy approval. Also entering into the provider portal, again on a monthly basis, is entering the EBP referrals to providers. So the total number of candidates referred to an EBP provider. And then we're looking at service uptake. So like I mentioned before, reach really tells us we're looking at how many families are referred, how many get the service, and how many complete the service. So tracking the number of candidates who started the EBP, who did not start PAT, and the total number of candidates who completed the full PAT curriculum. So similar to capacity, when you're looking at this data and when the state is looking at this data, really want to look at, are there any areas where we might need to improve on referral service uptake or service completion? So it is a helpful way of looking at maybe there are a lot of referrals coming in, but we're not starting the service or completing the service for a lot of the referrals. And so what can we do differently to start the service and or complete the service for families? So let's move to outcomes. So on page 6 of the brief, you'll see outcomes. This table outlines all of the data elements to track for outcomes. So that helps us to see, are we providing the service, and how is that impacting families when we're providing this service? So these data elements and the next slides are data elements that are required by the PAT developers. So you might also hear the term purveyors. So the folks that developed the Parents as Teachers program, we met with them and learned what they're requiring for people to implement PAT, not just for Family First, but to implement it and maintain fidelity to the model. So they let us know that it's required to track increased positive parenting practices, to track improved pregnancy outcomes, and to track improved child health and development. So back to that earlier slide, on slide 12, if you have access to the slide deck, reminder that this is information that you might already be tracking, but it's also information that your purveyor, the Parents as Teachers developer, are tracking. And so a really big benefit for implementing PAT is it's one of the EBPs for California that has a purveyor that is tracking this information and will be submitting it to the state. So the data elements on this slide are the outcome data elements, and they're being reported to CDSS in the CARES system by the purveyor or the developer. So the developer of PAT is inputting the information for your provider site using a provider template that we built because they're already tracking this information. So while we think it's really important for you to know what they're tracking and what is being sent to CDSS and the state and the feds for 4E reimbursement, just want to give you that great news that this data elements on this slide and the next slide are not data elements that you need to track on your own in addition to what you're already doing, because the purveyor has already agreed to submit that information in this tracking template that will go to CARES. So let's go to the rest of the outcomes data elements. So the rest of the elements are listed on here, but they're for improved caregiver health. It's just how this is on page 7. It's just how the brief is laid out, that there's some data elements for outcomes that is on the same page as fidelity. So again, what you see on here in this table, these are data elements that the purveyor is tracking as you're implementing PAT and submitting that to CDSS and CARES. These are really important data elements for us to understand how is PAT impacting the families that are enrolled in the PAT service. So monitoring whether it's improving caregiver health. And if you're implementing PAT already, you know that PAT has a list of tools that you can use to track this, and all of those tools are written in this EBP brief as well, so that you can take a look at them and get a better understanding of what additional tools you need to implement and use as you're providing the PAT service. So we move to fidelity. See here on page 7, there's an overview of fidelity. So like I mentioned before, fidelity is a term that is used by evidence-based program providers and developers across the country, separate from Family First. It really helps us to track whether an EBP is being implemented as providers are trained in implementing it. So if we go to the next slide, you can see the data elements that PAT developer requires. So the PAT developer requires us to monitor provider training. So tracking whether providers have completed the required training and how often. And we have identified on here the target that is required by the PAT developer. So the targets here, you see 100% for the required training. That is determined by the PAT developer. So they want 100% of PAT practitioners to implement this model after being trained. So PAT developer is also requiring providers to monitor whether the supervisor to parent educator ratio is 6:1 or lower, so that there's only 6 staff reporting to the supervisor. They also want to make sure that visit frequency requirements are met, so that families with 1 or few stressors and families with 2 or more stressors are receiving the required number of visits per month. And you can see there, that's 70%, 5% of families are receiving the required number of visits per month. PAT developer is also tracking the percent of newly enrolled children who are meeting minimally required screening requirements. This includes initial screening and annual screening. We also want to make sure that people who are implementing PAT are submitting their APR, annual progress report, on a timely basis. So, affiliate performance report on time. So including all of the relevant fidelity data to PAT on an annual basis on time. That's something that PAT purveyor or developer is tracking. And finally, for fidelity, the PAT developer wants to make sure that each affiliate site meets at least 60% of the 21 essential PAT standards. And that goal is that 100% compliance in order to ensure that sites are implementing the essential requirements of PAT. So like I said before, these are fidelity requirements that were developed by the purveyor required to implement PAT, whether it's for private pay or behavioral health implementation or 4E reimbursement. So these are data elements that are super important, and if there are data elements where a provider or a county is not meeting those target levels, we want to talk about that and see where we can target some improvement planning. So like I said before, fidelity, there are reporting requirements that you already have if you're implementing PAT, and that you have processes in place to track everything that PAT is requiring. But for Family First in California, it's very good news that we've confirmed that PAT developers will be tracking this fidelity information and submitting it via a template to CARES. So that's not double data entry or data tracking that you need to do for fidelity or outcomes. So let's move to talking about when we're going to get going on this work. So we mentioned before that there's a CQI plan that's publicly available. Soon we will have an implementation plan that will be publicly available. That should be coming and posted on the CFPIC website early this fall, likely in October. And that goes beyond what is written in the CQI plan to give more detail on the training process for implementing Family First in California, data tools that will be used, like these tracking templates that I referenced, and contract guidance. So contract guidance for counties to implement or update any contracts you have with PAT providers or other EBP providers. And this implementation plan will also include support plans and recruitment plans for lived expert and tribal representatives who will be a really integral part of implementing CQI for Family First. So that should be, again, publicly available in the next 4 or 5 months. And so stay tuned for that. And the CFPIC website has so much information related to Family First, and that is where this will be housed once it's complete. One more slide for me to talk about what else is coming next. We know that a lot of this information is new to many people, and CQI in general for Family First is new for all states because many states have been implementing CQI plans for CFSR or child welfare or any other required programs for federal reimbursement. But Family First CQI is new for all states. And so there's a robust training and support plan that is coming. Before we start that training and support plan, we want to gauge how states or how counties are doing and implementing CQI or Family First services right now. So if you're an FFPS lead and you're on this call, or a CQI lead and you're on this call, you should have received a survey link for a statewide CQI survey. Please fill that out if you haven't yet done so. It's due on July 25th, and that'll really help us to get some baseline data on county CQI structures and staffing to really help to build and really strengthen this CQI infrastructure and training plan and implementation plan for starting in 2026. So starting in 2026, there will be CQI training and skill building for all counties that are implementing Family First prevention services, a training on what we just talked about today. So a really robust, comprehensive training on the measurement framework that we talked about today, and the role of providers and counties for tracking that information, and how to use that information when developing improvement plans. We also will be supporting lived and community experts and tribal representatives because there will be a really big part. They will all be a really big part of this CQI plan and implementing improvement plans and evaluating EBP data. And finally, there's going to be technical assistance and peer learning. So we know that people learn best from hearing from others that are doing similar work. And so starting in 2026, after that CQI training, there will be a peer learning series where counties are encouraged to participate, coming together as a county to learn from other counties in similar region, to hear about what they're doing to implement PAT and other EBPs. So that Regional Learning Collaborative is a peer learning service series that is called the Prevention Continuous Quality Improvement Learning Collaborative, and the acronym is PCC. So you'll be able to learn a lot more about that if you read the CQI plan, and once it's out, the implementation plan will also have a lot of information related to that. So that is a lot of information that I just shared. Just want to reassure you that we will be providing support along the way, that there is, like I said, a lot of technical assistance and learning and training opportunities coming. We have about 1.5 years before this goes live. So take a look at the CQI plan and these briefs, and when it's available, the implementation plan, to really feel more prepared to implement PAT for Family First 4E reimbursement. That's all for me. So thank you so much.
Awesome. Thank you, Jenny. So this will be an opportunity for us to pause and just maybe look through some of the questions that have been dropped into the chat. Thank you to presenters who have been answering some of those questions as we go. But I want to just touch base on some of the ones that I saw just to highlight in case you missed it. Now, presenters, if you have anything that you want to add to the response or to answer in more depth, please bring yourself off of mute. And for participants, if you have a question that's brewing, please drop it into the chat. This is a great group to ask it in front of. So the first question I captured was, is there a way that we can get involved with providing feedback on the system as it's being built? Danielle, you're speaking our feedback 360 language. We love that. And Derek said, hi, Danielle, we do have an advisory group that is involved in the feedback process. Here's a link to learn more and apply if you're interested. Derek, is there any requirements? Can anybody apply for that SurveyMonkey link if they're also like, hey, I'd love to be a part of the building or development process?
Yeah, so thanks so much for the question. And I think this is a great opportunity to share opportunities beyond just the feedback on CARES development that I know has been more recently that the advisory has been able to do. But this is really part of the FFPS program at large as well, to be part of that advisory process. And so that link takes you to the survey. Anybody can apply. We're trying to include everybody from all walks of child and family serving systems, lived experts, everybody that has some form of touch with the FFPS and CPP work in their counties, tribes, communities. And so we encourage you to apply. I would just note that we do have limited space on the committees as well. And so there are vacancies that are announced, and we do announce those quarterly. And so if you, as registering for this event as well, you should be subscribed to our CPP Spotlight that'll come out monthly, but also release those vacancies quarterly. You could also find the vacancies listed on our website, and I'll drop that in the chat, just so you're aware.
Thank you. And then I saw another question that you also followed up with. The question was, where did those caseload numbers come from? The thought was that the caseload numbers may be high, and that was during slide, we were talking about page 4 of the guide of the brief. Now, let's see, there was a response to that, Derek. I know you said that you can follow up and confirm, but Chapin Hall, any thoughts about that as well for page 4 of the caseloads for PAT? Were those examples or were they pulled from something?
Those are straight from the PAT developer. So while they are high, that is what we confirmed from the developer are there.
And so just to make it clear, Pat just says that we can't go above those, but those are not anywhere near what standard caseloads are for people who are doing that. We're talking about 15 families, maybe 20 annually. But then when we start to talk about working with families in reunification, there's got to be a lot of wiggle room because those families or those visits are broken up into 2. You're going to visitations. So really full-time parent educators are working with about 15 families. So it's a little scary when we see that number and when you're tying it to reimbursement, because nobody will meet the contract.
Yeah, that wouldn't be a requirement to go that high. It's the PAT has said don't go higher than that.
Monica says, don't worry about that. I will not.
Nobody's doing that.
Okay. Monica, what kind of organization are you joining us from? Because there might be people that are like, thank you for asking the question, Monica.
And so those of us that are doing PAT in California, we actually meet monthly, but I'm with the County Office of Education, and we've been doing Parents as Teachers since 2019. And so, we've learned a lot over the past 6 years, and that's why we're like, what?
Yeah, no, thank you for the question. No, thank you. Also, I saw a question Veronica had mentioned, when reporting staffing, are we reporting for all grants together? And Derek, you did provide some clarification. This would only be for those staff that are serving families as part of the FFPS program for 4E reimbursement. Okay, so Veronica, if you have a follow-up question or if anyone does, please make sure that you ask. I do see one comment that we just wanted to highlight as well. Pat gives us a list of options for parent outcome tools, but not all of those options directly measure parent-child interactions. Thank you for highlighting that, Monica, for us.
It's okay. Then I saw that you said that they had the list, and so I just looked at the footnote. And so the approved measures are there, but just so that you know, not each of those directly measures parent-child interaction. But if you're okay with that, leaving that language there, then we're okay with that.
Awesome. And then I saw a question in here. It was also Barry addressed it. Caitlin, your question was, does every PAT provider have access to the CARES provider portal? Barry said all PAT providers that are providing services that will be reimbursed by Title IV funds will have access to the CARES provider portal. Counties will approve all access requests from providers. But just to be clear for people that are like checking their email, like, did I miss something about CARES? Just to be clear, there wouldn't be access at this time. Is that correct? Okay, I see there, that is correct. Okay. And then how do we go about approving these requests from providers? I think we need to troubleshoot this. We have a CBO providing PAT, and we're unclear of this process. And Barry, thank you for mentioning more information will be forthcoming on the provider portal and accessing it. It's still under development. And so if you think you've missed the party, you haven't yet, that's good. It's still coming. I also saw the question that it sounds like we would all need to use the Piccolo tool. And then Monica said, nope, gotcha. I see all the options we have are approved PAT caregiver child interaction tools, and then you've listed some. Wonderful. And then there is a question in the chat. Thank you, Carl. The question is about discussing the standard further. And that's about the requirements and what the ratios are, what the essential requirements are. Would any of our panelists like to take it?
Sure,
I'll read it out.
Yeah,
Oh, sorry.
I can take it. Carl's asking about the ratio for supervisor to staff. So that Pat is saying that the essential requirement is that a supervisor can have 12 staff, and the data element is assessing whether the supervisor has 6 staff or not. Ultimately, this is based on what the parents as teachers, purveyor, and developer said that they are monitoring closely. And although it's not something that is required for 4E reimbursement, it's something that is going to be tracked when you're inputting the fidelity information. When the PAT developer is inputting it's a provider's staff to supervisor ratio, they're looking at that higher level of 1 to 6. Doesn't mean that you won't be able to get reimbursement for 4E reimbursement for these services. It's just that that's the goal that they've set, and we want to look at that closely if there's programs or providers that are not meeting that higher blue ribbon standard.
That's great. Thank you, Susan. I see your question that just came through. Are you considering a crosswalk between CANS and PAT?
I'm not sure I understand the question, Susan. The CANS tool would be something that's very different than the program PAT. So all I know what CANS is the CANS assessment tool. So if there's another CANS.
Yeah. And Susan,
I'm
you
not
can
familiar.
unmute yourself if you want to give us like maybe some insight into your question, and then we can answer it more clearly.
Yeah, absolutely. So, the counties are deeply embedded in CANS right now because we're preparing for a rollout in 2026. So CANS measures child youth functioning, caregiver needs, and life domains. And PAT is a little bit different. It tracks parenting behaviors like child development and home visit quality. But I believe that there is maybe some overlap in terms of like family functioning, life functioning domains with the LSP domain. Now, I mean, I'm just looking at it from a cursory standpoint, but I feel that, that crosswalk between those very similar domains or domain language could create alignment and really could help, since we're going to be living in both of these worlds. We're going to be deeply embedded in CANS, and we're going to have to, follow this CQI fidelity for parents as teachers. So I think that it creates an opportunity for maybe creating some type of crosswalk between these two frameworks.
It sounds like what you're saying too, Susan, is, and I see Sarah, your comment as well about that link, is you're looking for an option, like an opportunity for a through line, something that kind of, uses these different tools that you're given in a way that where they speak together and they're not working individually. Is that right?
Yeah, some type of synergy. Like, so where I'm just like, okay, yeah, I'm talking about family life functioning, but I know that this family life functioning domain also addresses in some degree, the LSP domain on family relationships or stability, right? So I know that it might require a little deeper evaluation of both of those domains. But I think in terms of workflow transformation and supporting our staff who are going to be looking at it, I think it would be very helpful.
Yeah. And you know what I appreciate that about that, Susan, is it sounds like what you are recommending or asking about isn't like an easy yes, or they'd be like, yeah, we already made one, right? You're presenting things that give a work group pause, which is the purpose of this kind of work group, not just to give information, but also to share, hey, this is a tool, this is a gap, this is something that might be helpful to make sure that this happens. So I just really want to say how much I appreciate your feedback. And I do think that this is the right place to bring it. Panelists may not have an answer today because it's probably the first time anyone's ever recommended that, right? Like, as you said it, I saw people go like, like I've never heard that one before, which is perfect. There may not be an answer today, of course. However, the idea is that these work groups kind of continue, and as these feedback opportunities happen, I'm excited about the possibility of what that could maybe possibly provide.
Yes, and I'm pretty sure that there are people on here already who are thinking about logic models, and so I look forward to like what they come up with.
Oh my gosh, I'll prove it, Susan. If somebody asked a question or made a comment that you did not say, but you were like, I have that question, or that's a great comment, say me in the chat. Just type it in. If you are someone who saw a comment or a question that you didn't ask yourself, but you're glad someone did, say me in the chat. I am certain. Yes. How did I know? Because because this is kind of the purpose, right? By asking questions and providing feedback, you might have voiced something that someone else may not have even thought it was a question.
Right.
Such is the value of a work group. And I knew it. I knew the right people were here, and you are all proving it. And so if there are any other questions or thoughts, and I see Kathleen also thinking of this CANS thing, which is kind of the brainstorming piece where people go like, if there was a path, let's think about this. If there was a pathway, how would it work? How might it not work? What could it look like? And so I just appreciate that people are considering the information today, the possibilities today, and you're also probably thinking about what now about today's topic, right?
Right.
All are valid. As a matter of fact, I think we have one last slide. And this last slide kind of talks about the what now, like what do we do about it? And, something that I would also ask you to consider is, was this helpful? Was this insightful? Is this the right start to the right conversation? The idea is that it would continue, that there will be more, if not about this EBP, but others. Is this type of setting the right setting to have these conversations? If there's something about this session that worked really well for you, tell us in the chat. You don't have to say to everybody. You could say it just to us, the hosts. If there's something that was missing in this conversation, please also voice that. That only helps the presenters for the next session better meet your needs, which is what this is all about. So here are some questions, speaking of needs, or I'm sorry, next steps and homework, if you will. Like, take a breath. We're not going to score your homework, but here are some things that we recommend if you want to do something with this. Number one, review that CQI plan that was linked in the chat. I'm grateful that we had the chance to talk about it. It was dropped in there. A copy of the links are sent in a follow-up. Actually, they are going to be shared on CalPrevents and the FFPIC website. Sign up for CalPrevent Statewide Connect. I'm curious, if you are not on CalPrevents yet, will you give me a reaction on the bottom of your screen? It looks like a little heart. You can choose whatever shape you want. I just want to see visually who is not in CalPrevents yet. And by the way, I know how many people are in CalPrevents, so I'm going to think it's a Christmas miracle if everybody here is already in it. There's no way. I see 3 people. I'm sure there's more. Well, then we would encourage you to follow the link for the CalPrevent Statewide Connect. The recording and materials are going to be shared via CalPrevents. That'll be a great spot to find it, and on the CFPIC website. There's a town hall coming. I'm not sure if anyone on this panel is going to be a part of that town hall. If you'd like to give the folks a pitch as to why they should join, please feel free to do so. And then lastly, but not leastly, convene with CPP leads and team to bring your remaining questions to these teams. The brainstorming doesn't stop here. You can take it with you and always, bring those questions into a future work group. All right. Any last questions, thoughts, wishes, hopes? Before we conclude our time, we want to make sure that this is the most valuable for you. So if there's anything that stood out to you that would be helpful, anything that you'd like to add or change, you can unmute yourself. You can also drop it right into the chat. Oh, I do see someone that says, could you please send a follow-up email? And Derek says, yes, we will, which is great. I also see some of the links in there, which I'm grateful for. And then the town hall flyer is in there as well for registration. Anything? All right. Well, then with that, we want to say thank you so much for being here. If you receive an invitation to join us for a future work group, the hope is that you will come, you will participate, and you'll see exactly what, you've had a chance to see exactly what it might feel like. But of course, with your feedback, it only gets better. All right. Thank you all so much. Have a wonderful rest of your day. Thank you so much for everything you do. Bye, everyone. We'll hang out for some questions if you need us. If not, we're just hanging out for any questions that you might have. Otherwise, in just a few moments, we will be politely ushering you to the exit ourselves.